So tonight we're continuing the conversation about menopause. And really, before we get into menopause, what we're going to do is that we are going to talk about midlife health. Because the reality is, you move from pre-puberty to puberty to fertility to midlife, and then from midlife to geriatric or gerontology. And there are a couple of years or decades that happens during every time. So right now, my little irritation is that people are keep talking about blaming menopause for everything. And a lot of it is not just menopause. It's just midlife. It's just midlife health. So let's talk about the word today. The word now today is from Ecclesiastes 3:1. And if anybody knows, is Ecclesiastes all the way through to verse 9. This verse 1 said, "There is a time for everything and a season for every activity under the heavens." So in this season of midlife, there's a time for everything and a season for every activity under the heavens. And so please do not think that you'll stay here forever. And if you're quote unquote out of midlife, as we'll look a little later, it does not mean that what needs to happen is for your body, it's over. Not at all. We're going to focus today on the 5 principles to optimal health. Our focus tonight, I have the balanced nervous system, nourishing foods, appropriate exercise, adequate rest and relaxation, and a positive mental attitude. And the reality is your nervous system, as a chiropractor, your nervous system is the top of that table. And every other principle falls along and holds that together. Tonight, we're going to focus on a positive mental attitude. We'll continue the conversation of what it means to make sure that you are in the right mindset toward what your health goes through. So since we were together last, I completed their certificates at Harvard Medical School. Thank you, thank you, thank you for all of those of you who've been praying along with me. It was tough because I was in the middle of also preparing Optimal Oasis and getting it ready. But this was a topic that's very close to my heart. And when I was invited to do it, just about 100 of us from around the world participated in this cohort. And I was able to understand a bit more, a lot more actually, about some of the nuances that surround the body. So I knew a lot, but now my information, my education is a bit more streamlined. And the publication that I did was on my capstone is on genitourinary symptoms of the pelvic floor and the pelvis health, like the bowl that I spoke about, and I'll talk about a little tonight. How do we keep that healthy? Because people present to me with low back pain, but it could be any of those symptoms or concerns around their pelvic health or menopause that may be causing a problem. I've been invited to extend this into a publication. And if I do extend it that publication, we're going to tie it to a study. And so if that's the case, then you may get an invitation to participate in a study, especially now that the fibroid study is over and they're tabulating the data. So we shall see. So they said it first. At Harvard, one of the conversations that we had in my cohort was midlife is a pivotal period where targeted strategies can dramatically, in their word, dramatically, I highlighted it, alter long-term health outcomes. And this is important because just like how if your puberty was not comfortable for you, your fertility may be off. So if you had acne in your puberty and they decided to give you birth control very early, it could affect your fertility in your 30s. And so if your teens and 20s was built around using birth control, chemical birth control, your 30s could very well look like a chemical-based pregnancy. So we know that in midlife, after age 35, how your body works, how your body's managed, how it's helps you through the menopausal years, and then that in turn helps you when you're in your geriatric years. So they use the phrase dramatically, and this is important because we know that if we're able to help someone in the stage before they get to the next stage, right? So if you help me build a good foundation now, when I age up in a year, two, three, four, five, in a decade, I'm coming from a much stronger, sturdier place. The goal is to improve. When you talk about, think of midlife health, or you talk about midlife health, is to improve your cardiovascular system, your bone health, your brain, and your emotional health. For me, I wrote economically right there, make it economically feasible, because women spend a tremendous amount of money on their health. And some people are chasing pipe dreams. So they spend thousands and thousands of dollars to get an answer that's pretty simple, in my opinion, pretty straightforward. So the reason why I'm having these conversations is to say, listen, from my viewpoint, there's an alternative for you. And I want to encourage you to consider the natural way. Hard, but natural. This is sad, very sad, but true. And you've probably heard it say this information shared before, but in this particular study that we did, or this particular cohort, Dr. Lydia Pace, who is an associate professor of medicine at Harvard Medical School, but she's also Brigham Young as well, and she leads quite a few women studies. She said, many people are surprised to learn that most of the knowledge our doctors gained in medical school was derived from research on male humans, male animals, and male cells. In fact, it was not until the early 1990s, early, that means just about 20 years ago or so, that the United States, because this cohort was made up of people from around the world, and I was very fortunate to be in there. I was the only chiropractor in the group, two women of color in the group. The National Institutes of Health. So it wasn't until the early 1990s that the United States NIH mandated that federally funded clinical research studies include females. So up until the early 1990s, any studies that came out about our health, they used male cells. They based it on testosterone. They based it on male animals or humans. And so some of the older help for women was not right at all. Remember, we talked about systems in the first time. My journey is all around this nervous system. How do I help your nervous system be cleared and aligned? Because that is the foundation of all other systems. But tonight, we're definitely not going to address the male reproductive system. And there, I want you to put in your intuitive system, your energy system, your love system, some other system to make up the 12 systems that he talk about in the body. We are going to focus a little bit on the female reproductive system, because when it comes to menopause, this is the conversation that people are saying is the problem of midlife, and I'm saying a little reverse. Your midlife health has menopause as a piece of it. So there, right, 12 systems that we teach. If we remove the male reproductive system, we're going to do the senses, right? Sight, sound, those systems, and touch. And so as a result, if you think of what happens in midlife, it changes how your body is moving, how your body is operating. A reminder, male and female pelvic girdle, very different. It's set up as a circle for a woman. So the undulating, the movement of these hips, movement of the joints are important. A male is much more straightforward if you compare the two. And so there's not a lot of movement that happens in a male pelvis. It goes back and forth. And so they tend to have a straight joint. For a woman, it needs to be a figure eight, the undulation that needs to happen. So dancing and moving is very important for the body. We went over the anatomy before, and some people said they could not see the slide clearly. So let's look at it again. Everywhere you see my green arrow, so here is the urinary bladder. The bladder sits up close and in front, just above the clitoris. And then the uterus sits like the roof of a house. It holds all of these organs together. So if a uterus has been removed, these things start to collapse. The bladder starts to collapse, the vaginal canal starts to collapse, the rectum kind of folds in a little bit on itself, right? Because that uterus is pulling forward and pulling the tension. It's just like if you ever go camping and you put your pegs and those pegs hold the tent together, and if one of the pegs come out, the tent starts to fold in a little bit on the side. That's exactly what happens in the pelvic bowl. So if you remove any organ, you're changing what's happening inside of the body. So here is this nice, most women are retroflexed. There are some women who are retroverted. So about 80% of women, their uterus leans to the front. There are a few women, about 20%, one fifth, that it falls backward. And these women tend to have significant back pain when they're pregnant, the baby is hidden, that we'll say. If they ever have a menstrual cramp, their low back is just broken because the uterus leaning forward has enough space to swell and to contract. When it goes backward, it's pushing into the intestines and into the spinal column. And so it's not so comfortable for them. Those are the women that sometimes have severe low back pain. So we always say to a woman in the chiropractic world, the physical health world, pelvic floor world, that if you are experience cramping during menstruation, lie flat on your back, bring your knees to your chest. It will move your uterus to neutral so that there's nice space there around so the uterus can have enough cramping to go through what it goes through. Wrapped around that uterus is your digestive system. There's a difference between your rectum and your anus. Your rectum is a little higher up in the tube where the sphincter is. And so if somebody has hemorrhoids, you can have the hemorrhoids further up in the internal area or down near the anus. They can hang near the anus, and that can create trouble because of the pain and the discomfort. And then here's the vagina. Right there, there's a vaginal canal that comes sandwiched between the bladder and the rectum. The clitoris I circled because there was a question about why would I say to a woman, make sure that you're getting an orgasm without the need for sex or penetration, as long as you stimulate the clitoris. So if you're bathing without a cloth or anything else, touching the clitoris stimulates it to produce a major blood flow. It's like washing your face. So now what happens when the clitoris is stimulated, all of these organs get very nice fresh blood. And that's important, especially if women are sitting a lot, if you have fibroids, if you're prone to urinary tract infections or bladder infections, if you have constipation and stool sits for a little bit and the fermentation happens. What happens is that when the clitoris gets a chance to get once it's stimulated, and I say when you're bathing or when you're wiping yourself when you've urinated, you're going to touch the clitoris, and the clitoris is going to send signal that allows beautiful, beautiful, nice, fresh oxygenated blood, right, from the arteries throughout this lower canal that's so tight. Another way you can do this is undulating, dancing. This is a whole theory behind belly dance and hula hoop and just the gyration of the hips and making sure you don't have to do it with anybody else but in front of your mirror. But dance and rock your hips, get down and rock your hips and just make sure that your squat is not just a straight squat. Like drop your hips from side to side and roll it. The hips, going to go back to this one. These SI joints right here are built to move in an S and C shape for a woman. For a man, it's a straight joint. That's why we say if you found some bones on the side of the road, we can tell if they're a woman. And so it's important when we think of the flesh anatomy of this area here in midlife health, blood flow, which can influence blood pressure. And we'll talk about some other things a little later. And so it's important that as you sit, if you're wearing underwear that's restrictive, like a girdle, so when you take that off, massage the body, roll your body around, making sure that you are undulating. Am I emphasizing that enough? Move your hips, dance, dance, dance. And if you are even without penetrative sex, please, even if you're not sexually active at all, just making sure that when you bathe or wipe that you touch the clitoris and you introduce nice juicy blood flow for your health's sake. Let's talk about midlife. It's a season. Remember what Ecclesiastes said? So I'm going back to our scripture. there's a time for everything and a season for every activity under the heavens. And so when we come down to this season of midlife, it starts at 35, they say medically, and it ends somewhere about 65. And then after 65, you become a gerontologist. At gerontology, you move into gerontology. However, for some people, it starts at age 40, which seems to be the older standard. I don't know when it went down to 35. I don't know. The 65 seems so soon to me. And so age 40 to 70 has been the standard for many years that we considered midlife. But the major capsule, so you have a period of about 30 years when you're going through midlife. 30 years, 3 decades. But there's a capsule about 10 years when there's significant amount of pressure on the body. During that time, this is an AI overview. I asked it to tell me what women are doing through the ages of 45 and 55, and it said women experience a critical economic phase characterized by peak earning years and household asset accumulation. We need that money, honey, because the young woman takes care of the old woman. If you don't have it when you're young, it's harder to take care of yourself older. And it says it's running parallel to intense financial pressures from the menopausal transition, right? So you're spending a lot of money to keep yourself well as trying to save enough money to take care of you when you're old. The sandwich generation, the caregiving, they use the word burden, and I'm going to say loving burden. This is the age between 45 and 55 where women are helping children and or grandchildren to make their way through the world. They're helping themselves and whomever they work with. They're holding up the world. They're being Hercules. And then they're helping their parents, aging grandparents. They're helping spouses navigate the world. And there's a widening lifetime wealth gap that happens because women in the capsule of midlife with menopause, with caregiving, all these intersections can feel very torn, broken, stressed, stretched, stressed. And for that reason, their mental health changes. So often in midlife, nobody wants to talk about the pressures of mental health, the devastating effect that midlife has on mental health. When you should be in your cush years, right? So ideal life would be you have your children in your 20s and you're cruising in your 40s because those children are now grown up and adults. And if you happen to have kids later, your parents, back in the day, your parents died off when they were 50s and 60s. Now our parents are living to be 80s, 90s, and 100s. So as a result, what happens is a sandwich generation, that pressure from taking care of younger folks in your life and older folks while attempting to earn, spend money and taking care of yourself and save for the future. Did I tell you enough? There's a significant amount of pressure in this season, and the pressure happens in about 10 years, a decade. And so I'm going to say to you, my loving sister, pearls, they tell you pearls are formed in pressure under the ocean, the weight of the ocean, in a shell, in the dark, and a diamond is underground. And we have all these stories about pressure, and I want to say, use prayer. Find the opportunity to connect with other like-minded women and just pour into each other and make sure that you are holding each other up through this season. Not everybody's going to have the same experience at the same time, but we need each other. There's great sense of community. They tell me I'm 55, so they're like, you're on the verge, you're getting out on the end here. And I'm like, really? I don't know. I don't know, because I have tried over the years, and I encourage, and I know other people have around me, to find different things to help you. And so there are days when I feel fantastic, like, hey, it's all working, it's all coming together, it's all moving smoothly. And then other days I'm like, why are all the balls on the floor? Wasn't I holding it together yesterday? And so I want to encourage you that not every day is going to be the same. We're going to go in now to different seasons or different systems, rather, that are affected by this midlife health. And then we'll wrap it up with menopause. So let's talk about the cardiovascular shifts. So here you are in midlife and your blood vessel, so this is arteries and veins, the elasticity, the stretch of them decreases. So you're not as fluid, you're not as stretchy, you're not as Like a rubber band, it doesn't have the same elasticity, the same stretch. Cholesterol numbers can change, and we'll talk about cholesterol numbers in a moment. It says it often changes, and it ought to change, right? But if your blood pressure increases, so it goes from the numbers around 120 and to set over 70. So your systolic number, the top number, South Dakota, think South Dakota. So your systolic number, the number at the top, the number at the bottom goes from 120 over 70 and goes up to 130 over 80. Your doctor may say to you, oh, slow down. Your blood pressure is elevated. I need to give you some medication to keep that under control. The problem with that is that if your blood vessel elasticity is decreasing, you're not moving as much. You're carrying more weight on your structure, and those aren't moving so well. The body has to go up. The kidneys have to increase your blood pressure so that they can move fluid. So that's why we'll ask you to try diet and exercise changes first. And if you don't do well at managing that, then they may say, well, let's give you some medication to lower your blood pressure. But nothing changes your blood vessel elasticity like movement. You have to move. As long as you're staying in movement, you're going to bring those numbers down, unless you have something happening with your kidneys. So in my office, what I look for is your pulse rates. You have your systolic and diastolic, and then you have your pulse number underneath. The lower that pulse number is, if it's in the 50s and the 60s, then I know you're exercising and doing your cardio well. If it's in the 70s and 80s, not so much. But if you tell me you've been working out, then we have to look at the health of your kidneys. There's something happening with your kidneys, because blood pressure does not indicate a problem with your heart. It's a problem with the pump, the kidneys. Cholesterol, on the other hand, it's sent out by the body, by the liver. It's naturally produced. If you're vegan, cholesterol will still come out because cholesterol comes from animals. The body will still produce cholesterol because, in addition to being a lubricant and being a wall, so that the body, if you have infection or inflammation, the body will put cholesterol up like orange cones so that the body can heal behind the orange cones. Look at this slide. Cholesterol is needed for your hormones. Fat is needed. So if you don't eat fat, if you strip all the fat away from your diet, if you go fat-free, your hormones are going to be messed up. If in midlife your cholesterol numbers change, it's because your hormones are changing. So if you take a cholesterol lowering drug, your hormones may be off. I'm just saying, I'm the chiropractor. But when we talk about functional health, and we talk about the nerves being dried and stretched out and broken and torn and spontaneous tears in your shoulder and your knees and your low back and your hips, if I dry the muscle out, if I remove the fat, if I remove the cholesterol, which is the start, the precursor for all of these hormones, this lady drew it, but it's all over in science. All of these hormones started as cholesterol, and cholesterol is a fat. So if you strip it out of your diet, and then I gave you a cholesterol lowering versus a cholesterol supporting difference, I tell you to take garlic. Garlic breaks the cholesterol down, makes it thin so that the body can flush it out with bile. So you have some beets and you have some garlic. And so the cholesterol thins, and the bile from the beets, that's all nice and thin from the gallbladder, flushes the fat out that the body does not need. So it never stays and hardens. So be careful if you're on a cholesterol lowering medication and your hormones are in trouble. Have a conversation with your doctors about this. Please do. Because if they replace your hormones, your body's going to need cholesterol to manage those hormones. And you're going to play a hard and fast yo-yo where the body's going to try to produce cholesterol to manage these hormones. And you're taking in hormones. It's a volley that's... it's not going to win, because the liver is going to keep producing cholesterol, trying to manage the hormones. But your body may go through a phase where the cholesterol is elevated but for a season. You don't mind cholesterol looking higher in a lab. You just don't want it to stay there all the time. So every 90 days, you take your labs and your cholesterol is always up. You're like, what am I doing or changing? Am I exercising? Am I moving like I'm supposed to? Am I eating healthy, raw, right? If your triglycerides are when you look at your lipid panel, if your triglycerides are high, then you know your heart is not happy. So the conversation in midlife about what is appropriate cholesterol, the standard number they gave you is 200. But you have to check yourself and see what is your family's norm and check yourself and see what are your hormone levels doing. Do you see that it's in here? Let's talk about the metabolic changes. So body fat stays at the abdomen during the metabolic changes. So people have the little pooch, the fupa, so around the belly button and underneath the belly button, that's fat that's cushioning the uterus as it's going through its metabolic change. So the uterus is dying off, right? The lining of the uterus is dying off. And when things are dying, things around it swell. And so the body will do with it pads. It's like a mourning that happens. It's like, oh, you're going away. So I'm going to shut you down. So I'm going to give you this cushion of fat. If you have fat above the belly button consistently, that is when we're in trouble. So if the belly button, the umbilicus in the middle, if it's consistently above that, we get worried because that's visceral fat. That's the fat that's wrapping around the organs, particularly in the heart. So it's not going to function so well. So we want you to move more as much as you can. And that's where the dancing comes in. We want to see that body being able to move. And then lean muscle mass, it starts to decrease because the fat needs a place to stay. So the muscles now don't stay as strong as they were unless you're loathing them. And so they convert to fat because your body metabolic rate slows down. The body is saying to you, you are going into gerontology, and so we need you to slow down a bit. Don't slow down. Keep moving through this season. Bone density loss. I have this listed, the number 1, 2, 3, but they're all equally important. So what happens when your estrogen drops, your bone gets weaker. And your bone gets weaker. We don't quite know all of the science. There are a lot of theories around this. But the reality is your bones, especially your long bones, are where new cells are. Red blood cells are born in the long bones and they're sheltered and grow up in the long bones. Then they go to the spleen on the side by your stomach to mature. So if your estrogen is lowered and you go to weak bone, is it that the body decided that over time that you're going to die off? So it does not need to pull as much calcium in? The question remains. So some theorists say that it's really bad. That's why they will offer estrogen so that your bones can be stronger. We, functional health, encourage you to move more, to exercise to build stronger bones. So osteopenia is the thinning of the bones. The bones so they get weaker and they get thinner. And I'll show you a picture of what that looks like in a moment. In osteoporosis, you see the penia here, thinning, but the O, all of these O's, 1, 2, 3, 4, 4 O's mean that they're holes in the bone. So that's how you tell the difference. So if you have an X-ray, and the X-ray says you have osteopenia, it's becoming thin like a sheet. If they say you have osis, and this is more accurately determined on a bone density test, the osis, 4 O's, 4 holes, right? Holes in them, then you're likely to have fractures. And these can happen inside. So sometimes you'll hear some doctors say, I'm going to give you estrogen so that your bones can get stronger so that they can prevent this. That's not the only thing you can do. Walking, body weight, dancing, move. Did I say dancing enough? Moving around, moving around on your body will help your bones to be stronger. Look at this image going from left to right. So the one that's all compact and looks like a slice of bread or a cracker, that's your bone at normal density. And then as you move across the frame, it starts to go to penia. And then the next one, the third one is porosis. You see the holes start appearing. And then all the way over and there are lots and lots of holes. So instead of being nice, tight, clustered together, compact, now you have all these holes in it. That's osis. Four holes. Oh, sorry, four O's, osteoporosis, holes in the bone. So the next time you bite into, don't bite into a chicken leg. But if you were looking at, if you bought meat, if you bought bones and you actually look at the bones, if you're making bone broth or soap, you can sometimes tell the age of the animal because depending on when the marrow has been removed, you can tell what's happening in terms of the quality, how close the bones are together. Young bones close together, the matrix of the bone, the inside of the bone, how well it's showing up. Hormonal shifts, aka menopause. So estrogen and progesterone disappears because during a period of menopause, you don't have to have children, right? Now your ovaries stop releasing eggs. And I was having this conversation a little earlier. This is so good because the body says, listen, we're not going to have babies anymore. So we don't need to shift these eggs to the uterus. We don't need to see if they're going to get fertilized and if they're going to implant. So the uterus is shedding its lining so that it's going to stop having a menstrual cycle. And sorry, that should say menstrual cycles stop with an S. I'll correct that later before it goes out. But your ovaries stop releasing those eggs. So stop and think about this for a moment. You were born, a woman is born with all the eggs she's ever going to have. And if your ovaries stop releasing the eggs, how are the eggs getting out of your body? Do they stay and just calcify? Do they just melt? No. I'm going to skip that slide and come to this, and then we'll go back to that slide. This is what happens. The body incinerates the eggs. It kills them off. You have sudden body heat happening, sudden, intense body heat happening. The body's like, I have an egg there, zzz, 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 like a laser. It is going to kill off the eggs. The eggs cannot stay there. If the eggs stay, they were born with them. The body doesn't need them anymore. The body has to kill the eggs off with heat. It has to burn them. So when you have a hot flash, eggs are being burned. If you stop your hot flashes, if you delay your hot flashes, you will keep your eggs and you will stay longer in menopause. Dr. Levi said it. So in the midlife process, you may have to adjust your attitude to say, I'm going to go through this season of heat and come out of the end of it cool and relaxed. It's going to be uncomfortable for a period of time, and then it's going to change. Maybe. Please make a note of this. And we're going to talk about what that looks like. Now, when those night sweats come, the way your body works overnight is that it does repair. And the way it gets rid of the trash is through urination and defecation, going to the bathroom and having a bowel movement. You're going to sweat out the hormones. We said that the estrogen and progesterone disappears. It does not melt into thin air. It can't possibly melt into thin air. It has to come through your excretory system. So your breath, your urine, your bowel movement, and your sweat. So if you stop your night sweats, instead of go through the night sweats, you're asking the body to keep the estrogen and progesterone it's trying to get rid of. It's a thought. Because what the body does, it cools itself down after every heat episode. So you may feel chilly or you may feel like you're flushing. So while this process of midlife and menopause is uncomfortable, it's necessary. So it requires some planning and it requires some resetting of your headspace about how you'll heal from this as you go through midlife versus trying to push it away. Because instead of you being a decade in discomfort or a year or two in discomfort, you might be there much longer. I was having a conversation with somebody earlier about brain fog. when your body has so much to deal with, it shuts itself down. It's going to decide that it does not need to do everything all at once. So let some of those balls fall on the floor. So you may not remember something that you were supposed to do because the body decided it's not important at that moment and it needs you to do, which is critical, right? Because you could forget something very important. But in that moment, you forgive yourself because you're going through something major in your body, a major phase. In the last one, before I go forward, let me go backward a little bit. From the last session, we were talking about estrogen. And that's because some people are on hormones, not estrogen, but progesterone. And I'm still studying why somebody would be given progesterone. And I understand that the language around it is that it's used to counter the absence of estrogen. But the body's trying to get rid of estrogen and progesterone and keep the testosterone down because there are no babies to be had. But there are some theorists or scientists that says no, if you don't give any estrogen because a person is sensitive to it, meaning that they have a family history of breast cancer, breast lumps, any of those things, they cannot have estrogen. But E and P are not the same. They don't fit into the cells the same way. They don't operate similarly. One keeps babies, one lets babies go. It's very different. So I have much more studying to do before I tell someone you cannot have hormones at all. That's not my place right now. My place right now is to explain to you what type of hormone you need if you're going to have it. And this slide was born out of me attempting to explain an answer to someone from the last time we did this study, this conversation. And it's that estrogen is split into three types, E2, 1, and 3. So if you look at the slide, I circled the 1. So this is menopausal. If you happen to have, and we'll talk a little later about the types of estrogen, how you can get it in your body. 1, E1, E1, me, myself, and I. I want to make sure that my product, my estrogen product, not that I'm taking one, estrone, O-N-E. You see that one? O-N-E at the end of the word, O-N-E, E1, E1, E1. If the version you're being given does not E1, do not take it because OL and OL are for two different groups of people. When it's E2, it's mommy and me. So it's a young person who's in fertility, not pregnant, not menopausal. They are potentially going to get pregnant. So if you're taking estradiol, it's going to keep you in fertility. So you're still going to have a period. You're still going to have a lining. Your eggs are not going to decide to die off. The body is going to keep you young. You may have fantastic skin and hair and nails, the fountain of youth, but the body's going to think that you're nowhere near menopause. It's going to hold you there. Estrol, that's when pregnancy, the body produces it naturally. The placenta, the baby puts that out. And when you're not pregnant, you're not going to have it. So if God in his infinite wisdom only lets the placenta produce it during baby time for the baby, how can man reproduce that and give it to you and have a good result? So please be very careful that if you are taking estrogen to help you with the symptoms of menopause, because that's your decision. I support you making the decision, and I just want to make sure that you're taking the right type of estrogen. And then we'll talk a little bit about the forms of estrogen that you can take, because your doctor may make a decision for you, and you have to be informed enough to know that you're taking estrone, O-N-E, 1 estrone. So we talked about the vasomotor symptoms, right? So all of these, your heart's racing, your body's aching, your joints are not where they need to be. You don't know, you're like, this is not hurting 2 weeks ago. Why is it hurting now? And why can I not get past it? And then this heat that's happening, that keeps happening. And so Dr. Levi says, is killing off these eggs. Well, when are these eggs going to die? And could they hurry up and die, please? And then I'm sweating, copious amounts of sweat. How can I stop the sweating? And she's telling me, let the sweat pour out because it's the the no longer needed hormones leaving my body in the sweat. Really? Yes. Please be encouraged. So here's my remedy for it. Killing snakes. When you killing snakes, nobody just taps at the snake like tap, tap, tap. You whack it. So you have got to stay hydrated. If you're heating up and you're sweating, make sure that your body has enough so that when the fire burns, the water comes, right? So to kill the egg, the heat comes and it kills the egg, it sears in the pan, and then the water comes and cools your body down. And then there's enough water inside, delicious water inside of your body that it flushes all of the hormones out easily so that you don't smell. Because women during menopause, they don't like to talk about this, but during menopause, you will smell the chemical leaving your body. You will smell the ammonia. That's what people say, why am I smelling like urine, pissy, pissy? I keep cleaning myself. It's the body getting rid of the hormones. So you're going to kill snakes, right? I don't know if anybody on the call has ever, on the webinar has ever killed a snake. I have, and you cannot play with it. You have to work it there. So you're going to do that with your hydration. Cucumbers and watermelon and strawberries and oranges and leafy greens and celery. Make sure your celery is organic because it's one of the dirty foods because it can absorb the chemicals. And then making sure that you're sipping throughout the day, carry a bottle of water, put your lemons inside if you need some lemon, mint, or cucumber in your water, soups and broths and teas. Make sure that you hydrate, 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 and making it such a part of what you have at every meal. We talk about in this season, making protein part of every meal. Hydrate. Please hydrate. Alrighty. And now let's talk about what was my capstone project. So for the capstone for Harvard, for anybody who joined late, I did this. Where is it? I did this thing, Women's Health and Wellness Program through Harvard Medical School, just wrapped it up. And because of that, I was able to prepare for research, a capstone project, and I'm doing it on the genitourinary syndrome, GSM. You'll see it in literature written as GSM, the genitourinary syndrome of menopause, because I do a lot of pelvic health work and we're moving more into pelvic health rehab. So it describes this, and I'm going to pause for a moment so that people can read. There's a lot of words on the slide. But it's really loss of estrogen at menopause, causes your tissues to be thin and dry, decreased elasticity and lubrication. You can have pain, just even wiping. It doesn't even have to be during sex or pelvic exams or wearing certain clothes like jeans. People talk about chafing and discomfort with their underwear. The common symptoms are vaginal dryness and burning on urination that can make people think that they have a urinary tract infection, but you can have an increased urinary tract infection because the canal is dry. This is most severe in women who've had both ovaries removed, and that's why surgical menopause, and that's why they are often doing a hysterectomy and keeping the ovaries in place. But you can still have the symptoms. And then absolutely anybody who is chemotherapy for any form of cancer, and if you've had any aromatase inhibitors for the prevention or treatment of breast cancer. So these symptoms can happen at any age because there are women in their 20s who have breast cancer, and there are women in their 20s who've had to have a hysterectomy for some form of cancer or some sort of mishap, an injury to the area. This slide talks about treatment options. And I'll come back to that other slide in questions during the questions if you need to ask. There are some treatment options. So there's some natural ones, vaginal lubricants versus moisturizers. So the lubricants are used during intercourse, penetrative intercourse. They're over the counter. People have tons of stuff. I always tell people try to make sure that it doesn't have any kind of silicone or irritant, anything that will cause you discomfort or irritation. because it takes a woman longer to get over any irritation in the canal, especially if she's been dry. So you test on the inside of your elbow for a few days to make sure that you don't have a reaction before you put it in your vaginal canal. Vaginal moisturizers, you don't have to be about sex at all, but there are some like Botanical line has V Fresh. It's a moisturizer for the canal. So if you're prone to vaginal infections or you feel dry, like if you wore a pair of jeans and it's chafing your vulva and you don't like that sensation or feel, or you wear your underwear and you're like, I'm always feel raw or I feel irritated in that area, then you may use a vaginal moisturizer. Very different from a lubricant because a moisturizer is just like you would moisturize your skin. They tend to be in suppositories and you'll use them overnight. Here are the vaginal estrogen therapy. These are the common ones. I listed them there, but you would want to check with your doctor to make sure that you're getting the right one. Because on this call, there's some women who need E2 and some women who need E1. So if you're still menstruating, you need E2. If you're having some symptoms that are not sounding right and your doctor thinks you need to be on estrogen or you're going through the fertility process or so, then E2. Me, my mom, and I, right? E1 is for a woman who's not. And you know what? A thought just ran across my head. I can't tell you the difference between them because I have deliberately tried not to learn the differences between these creams because I don't want to prescribe them or recommend them for anyone. Yes, not at all. Do you see this intravaginal dihydroepiandrosterone, ONE? That definitely we know is an E1 because it has the ONE in the name. And then this one is a new one. It has another name too, Oxy something. But this Premarin is an old one. 1, 2, 3, 4, 5. These five estrogen therapy prescription. Your primary gynecologist, sometimes an endocrinologist, will order it for you and they will have conversations with you around breast health, history of female related cancer, hormonal cancers. They'll test you, they'll manage it. I can talk to you about lubricants and I could talk to you about moisturizers and I can definitely talk to you about vaginal exercise. Sexual activities and exercise. As much when I was married, the whole thought is like, oh, this is purely for pleasure. It's actually for a woman's exercise as well, with or without a partner. You just have to be intentional if you're choosing to do this, that you're preparing your body before, during, and after. So you have to know yourself and know how you are. If you're not having sexual activity, yay to you. I think it's one of the sweetest times in your life when you can practice abstinence if you had been sexually active before, because it gives you a chance to do your stretching exercise. They're lubricated vaginal dilators that you can use to make sure the canal does not atrophy or collapse in, but you don't need to use them if you can do finger therapy, 2, 3, 4, 5 fingers, squeeze around them, do your Kegel exercises, and definitely pelvic floor physical therapy, which we are moving closer to. Now that we've opened the wellness center, there's going to be a number of activities that are deliberately designed for healthy pelvic floor, regardless of the age that you are. Start getting your questions going because I'm going to start wrapping up here. Remember, 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 menopause is menstruation in reverse. You've had it before. You went through this before during menstruation. See the long list, barely could hold on the slide. Things that happen during your menstrual cycle. But in puberty, you don't know to put it together. And you're busy, and some adult in your life is helping you manage your period. And now in menopause, the difference is you have all of these things could still be happening to you. The difference is you pay your own bills. So in menstruation, you may have had a brain fog, and you have it as menopause, but it's more detrimental now because you have to get the kids to school and go take your parents to their class and their doctor's appointment, and you're going back and forth. You may have had constipation and diarrhea during puberty. You having it now in menopause, but you have a meeting at 9 o'clock and you haven't had a bowel movement all morning and you think you're going to drink some coffee and get it done and your body's racing and you have a hot flash. You had the same things during menstruation. You've been through this before. The difference I was saying earlier is now you're responsible for your own bills. So it's heightened. It's heightened, but also as a recognition that when menstruation was leading you to fertility, menopause is leading you to gerontology. Because after you finish menopause, you are now considered in the geriatric age. I know, I know, I know. I can't believe it either. Remember, the reason why we did this tonight, Midlife Health and Menopause 2, was to encourage you to have a positive mental attitude about the journey, the season of midlife. Menopause happens to be one of the biggest things you hear everybody's talking about. Menopause is the problem. No, midlife is the decade or 3 decades where your body changes through the stages, and menopause happens to be the most, they think, the most expensive, but within that, you have to think about your heart health, metabolic health, all those other pieces, and not just reproductive health, not just menopause.